Welcome to Playful Beginnings, a podcast about the magic of play therapy for therapists, students, and anyone interested. In our podcast, we'll explore the deeper understanding of play therapy and the skills we use when working with children.
We hope to help you understand the why behind what we do and how it helps kids heal and grow. I'm Dr. Kristie Opiola, a working play therapist and university professor in North Carolina.
And I'm Dr. Maggie Parker, a play therapist and professor in Virginia.
Well, hey, Kristie.
Hey, Maggie, how are you?
I'm good. How are you today?
I'm doing well. Thanks for asking. I hope you are too.
I have been talking to some people who are listening to the podcast, and they were kind of curious. We talked about the toys and we've talked about what play therapy is. And I think there's still some confusion for those who aren't necessarily already in the play therapy world of what that looks like, what it is that we do in a room. And we talked about, toys are their words and play is their language and the importance of a relationship. But I thought maybe we could explore it a little bit deeper if you're up for that.
Yeah, I think that's a great idea. Sometimes it's hard or challenging to share what we do because we're all unique. But I think there's a base set of things that all play therapists do that we can talk about. And then maybe we can explore a little more about being child-centered play therapists and what that looks like in the room. Helpful to paint a broad brush of what play therapists do, but then we're all going to be a little unique in how we do delivery of service with the kiddos that we interact with.
And I think sometimes what I hear is, and I'm sure you've had this experience too, of parents will talk to them about this.
Yeah.
Or this happened in the room, or this happened at home or at school. Talk to them about this. And so I think sometimes there's this disconnect of, are they just playing or what's going on? And I know that you and I think we're on the same page of, if a parent brings something to us, we may file it away, but it's not something that we're going to bring to the child. And part of that is because we have a belief that the child is going to do what they need to do in the room. And the more we say, hey, this happened, we're asking them to kind of go into the past, which is really tough for kids.
Well, and also,
developmentally.
I think it also, play is such an experiential activity. So, right, it's hands-on, it's action-oriented. They're using more of their imaginative, creative side of their brain, even if they're playing through the experiences that they've had. And then when we ask a question or start talking about a direct scenario, sometimes I think it pulls it out of that part of their, way of being. We call it right hemisphere versus left hemisphere of the brain activities. So it almost pulls it to this very cognitive state. And it actually makes it sometimes harder for kids to play through when we're asking questions. I find that it just stops them playing altogether. In the playroom, we have, as we talked about, carefully set up the room for materials that allows them to express their experiences, their feelings, their worries, interactions they've had with people, stuff like that. And so I always cringe a little when people say they're just playing, because play is the most natural form of communicating. And so, yes, I think sometimes as adults, we can see it as, and I'm going to put this in air quotes, just play. But the reality is, play for children is really how they explore and work through what's happening in their worlds, how they're understanding the world, how they're making sense or doing meaning making, like cognitive space for them. And so asking them to talk really is contradictive to what's happening. Now, kids will talk naturally. Kids talk to me all the time in play. They narrate what they're doing. They direct me. They do all sorts of stuff. But I want to make sure we lay the groundwork as we keep talking. So as we invite children into the playroom, we do invite them utilize our toys in the ways that they're needing to use the toys and the materials, if that's art materials, if that's actually playthings, or to talk to us. We really allow children some of that freedom to express themselves in the playroom in the ways that they're needing. And so play therapy, I think, does look like, air quotes, just playing, but it feels very intentional in a play space that has chosen toys and other stuff to allow them to express feelings, thoughts. We can also see common behaviors that other people are experiencing and are stressful for them. And so those come up naturally in the playroom. So we often don't have to invite it by asking the question. That's where I wanted to go back to. And so that's been my experience in the play space with children.
Well, and I think, as you were saying, of how we invite them in the room is in here, you can choose to play with all of these toys in a lot of the ways that you would like to. So even just that statement is sending the message of this is yours to explore.
And you share what you want with us.
And you're in charge, and not everything goes. That's sometimes what people get nervous about too, is you just them do everything.
The other thing I think that's interesting, I don't know if you find this, but as parents share or have these requests for us to ask questions or explore certain things, my experience is those come up naturally in the playroom. I don't even have to ask the question because they're already doing it for me. And so now kids play a lot in metaphoric play. So it might not be that they set up a classroom and share exactly what happened in the classroom, but maybe they take on a role of a character that is having difficulty connecting with another person. One of my favorite experiences in a playroom with a kiddo has been a child who played out scenes from Beauty and the Beast. And this child personalized their role as Beast in the playroom. And what he was playing out through Beauty and the Beast was mimicking what I was hearing from teachers, from caregivers, from his guardian, all of those things. And so it's just interesting that they were asking me to teach skills on how to be a good friend. Well, he was exploring what that looked like as he role played the beast. And this child would specifically talk about that people don't understand the child's inner qualities. And so, which was some of his challenges in really engaging with his peers at school, at soccer, at, whatever the child was doing. And so it was just a really fascinating and reinforced that idea that I don't have to bring topics up. The kids are going to bring it up for me. And over several weeks, that's how he played every single time. And finally, at one point, he took off. He would literally dress up like the beast. I had a fur vest and some other stuff in the playroom, and he would take it off and try on a different role to see how that felt. And then correspondingly, as I was talking with his caregivers and teachers, they were saying that's actually what they were seeing on the playground, him trialing and erroring different ways of interacting with his peers. And so I think our belief in the inner goal directed parts of kids comes out when they have the space to really explore those different ways of being or ways of interacting with people or solving the challenges that they're going through in that moment. And the interesting thing for this child in particular is that the family and the people close to them often asked or told me that this child is obsessed with Beauty and the Beast. And so when I first saw it, I was like, oh, this child really loves Beauty and the Beast, right? I didn't see the connection. But over 2 or 3 sessions, I really saw the connection of what this child was trying to do and allowing that space and nurturing that space for the kiddo so that they could try on those different roles instead of telling them, because everyone had been telling the child up to then, and the child wasn't willing to shed the role of the beast. I think he felt threatened internally that there was something wrong or he wasn't good enough. But by giving him space, and by the end of the term, huge things were happening. They were invited to birthday parties. They were had people to sit with at lunch. Which were concerns before we started. And so I don't know if that's an example of maybe why not to lead, but I know it reinforced for me the importance of trusting the child's coming into the play space and being able to tell me the support that they needed during that time, so that they could really explore and feel safe in exploring what one of their biggest struggles were and one of their biggest desires. So that was the other interesting thing. This child really desired social connection with peers that they were really struggling to fulfill on their own. And with the support and acceptance of a therapist, they were able to figure that out without me needing to direct it or tell them how to be different than the beast.
Right. When I think what you're hitting on too is what I tell students is we are different types of adults in this situation. So we are taking on a different role in that we are non-directive depending on your theoretical, like the what you believe about children and counseling. It doesn't mean either that we're passive. So you weren't just sitting there letting this child play. It's
That
we interact with them much as we would adults. So we are reflecting the beast feels really lonely. The beast is scared. The beast is, and we're making these reflections based on what the child is doing in the room and how the child is presenting in the room, their emotional expressions, their facial expressions. I think sometimes my students worry that we are putting something on the children that doesn't fit. Part of that is you're taking all of your coursework about emotions and development and understanding, and you're really focusing on this child to try and understand what they're experiencing. And then you're kind of taking very educated guesses, if you will, by making these statements and reflections. There are all these skills that we do in this space to help. So, yes, they are playing and they're playing out their experience. And we are, similarly to how I view therapy with adults, is we're serving as a mirror and reflecting back so they can see what's happening with them in a different way. And so we do that through tracking, which is where we say, oh, you're doing this or you're doing that. We do it through reflecting content, which is when they're talking to us, how are we responding? Or reflecting feelings. What are they playing out and what emotions are being demonstrated?
share our understanding of their behaviors, thoughts, and actions more as a reflection than like a statement of confirmation.
They'll tell you if you're wrong. That's okay. Just like our adult clients will tell us that we're wrong, right? And so I don't have as much fear that I'm somehow projecting something onto a child that they're not already experiencing. I think that's where my students really struggle. But so when parents come and talk to us and they say, well, what are they just did a painting, right? Or it seems like they're painting. It's okay. Well, this is what I'm seeing, right? It seems as if there's a lot of painting about families and you're experiencing a shift in custody agreements and what that family looks like. And so as they're drawing it, they are processing what this means for them. And my job in that moment is your family is really important to you. And
You're confused on what's happening with your family, or you don't like it that you have to go to 2 different houses, because that might be what the painting's about. So it's not so much or the intensity in which they paint or play or do something with, because we also reflect that component of the feeling, kind of the thoughts behind it is how they express it is equally as important to us as what they express.
yeah, it's interesting how I've seen play and the way kids show up and engage within the room, depending on, presenting concern or what's going on. Just the ways in which I wouldn't necessarily, if I didn't have my training or speak with the parents, two kids can do the same type of play in the room and it reflects for me like different things that they're experiencing. I'm going to respond very differently. So you can use the bot bag, and a lot of times it's about mastery, wanting to feel powerful. I can knock it down. Sometimes it's about anger. You're really frustrated. You're hitting that as hard as you can, controlling it. I've had other people, it was so interesting. Every session, they would balance and they would just work really hard to balance. And I think they felt sometimes that their inner world was really chaotic. And so you're trying to see how, if you can stay on, you're trying to see what your body's capable of. You're exploring these things. And so, yes, they are playing out what we think they need to, we have that belief. And we are with them on that journey, just the same way that we would be with an adult on that journey. And we're holding emotional space for them, reflecting back what it is that we see. And so the more they can, again, with adults, when a therapist can respond to you, it seems as if you're really doing this. Sometimes it elicits a light bulb moment. And you're, oh my gosh, I had no idea. Whatever. I've hated Susan's my whole life. I never related it back to this one moment. I don't know. I'm just making up some stupid, but it's the same kind of thing, that it helps them internalize or externalize what's been internalized. I don't know if that.
I got distracted.
I know. I feel very distracted today too. I think we were talking about just the ways in which we assist in the process of play to make it therapeutic. That play, kids play, right? This is a different kind of type of experience because of the way in which we interact with them. That's part of the therapeutic process. It's not just someone random sitting with someone letting them play. It is our intentionality and how we're responding to them and how we're trying to understand and reflect back what we are experiencing them to be experiencing. That is the therapeutic piece. Or the relation. Oh, I don't know if I said that because the relationship is is therapeutic.
Well, I think that's what helps bring therapeutic change for kids. And again, this is going to be specific by theory. So it's also hard because Maggie and I both practice from the same theory. So we have very similar ways in which we interact with the children that we work with. But I do think holistically for play therapists in a playroom, it is how they're responding. It is how they are understanding what the child is sharing with them, and putting context to that related to maybe real world experiences or relational experiences that we're having in the playroom with the child. And so the child feels safe with us. But does the child feel like we're a threat? And does that mimic things that are happening outside? Does the child have a lot of shame or embarrassment about something? Play that out for us. And then are we willing to accept that? Are we going in to try to teach and change that? And then for the children that I work with, most of them, that feels threatening to them and unacceptable. And so they feel hurt or misunderstood when I attempt to direct it. And so by giving them the space and reflecting or sharing my understanding, we get to be that mirror. So then they get to see it from a different lens or hear it for the first time. They may feel it, but they're getting to hear it and say, that is how I feel. Oh, you understand me and you still like me, right? Like this is not a game changer for our relationship. And so they're willing to stay. It helps them feel more accepted internally so they don't have the distress around whatever that experience is.
Yeah.
And adults, we do this through talking. We have conversation about it. For kids, they do it by playing it out. And yes, we reflect it back to them, hopefully with acceptance, hopefully with empathy, hopefully with a lot of care. And that's what helps make change in children as they're hearing those messages back.
Yeah. I think there's two things I want to touch on. And one is, I don't know if you've seen the meme, and it's child played floor is lava for like 35 minutes. And then the note, how a play therapist would conceptualize that is child explored problem making or problem solving skills in high conflictual environments, right? So we're trying to extract what this play means for the child and reflect it back so that it can have that feeling of understanding and help them see things or experience things perhaps in a different way.
I also think in like that scenario, we're also giving the child a message that we trust them to figure this out, that we didn't jump in and tell them the solution to this problem, that we allowed them to struggle to figure it out with support from an adult who believes in them and allows them space to do that. I see often it's really hard to see kids struggle, maybe fail at things, but that is part of understanding our strengths and our, growth edges in ourselves. And, how do we speak about we can't be good at everything and we can't be under the false belief that we're good at everything or there's areas we're stronger in. I think giving them opportunity to trial and error and figure it out helps them see like, "Oh, I really like this. I don't like this. Oh, I didn't know I could do this." And so they get a pleasant surprise of really feeling accomplished and competent in areas without someone guiding them to feel competent, which I think feels different internally as an adult or as a kid.
And it's really focusing on their process and experience in it. You're really determined. You find this really hard. You don't like this, but it's important to you because effort is, I think, societally, so much is discussed on the outcome, whether it's an A or being told that you did a good job or getting the trophy. We very rarely talk about the effort that it takes and the importance of perseverance and continuing to go. And I think a lot of times, I don't know if it's just the area that I'm in, but there's a lot of perfectionism and high performance and a lot of feelings of inadequacy that kids are experiencing. And a lot of times they're playing that out in the playroom, whether it's trying to build a really tall tower that doesn't fall over or trying to be able to hit the ball back and forth 28 times instead of 24 times, and really just talking about their determination and their focus and how hard they're trying, because that is also worthwhile and important, almost more important than I think outside in adult life, that you try and keep going as opposed to try something and if it doesn't go the way you thought it would, giving up. And so it's a way in which kind of we're reflecting back what they're experiencing in that moment.
Yeah.
And it's so interesting too, because, talking about how it comes up, I had a child who was doing a lot of mastery play because feeling really a lot of inadequacy. And then all of a sudden they started playing out, creating a house and decorating this house. And there were 2 houses and there was a train in between. And so when I met with the parents, I kind of reflected, like, this play changed a little bit. And we just moved. And I was, oh, that tracks. That makes sense. So yeah, it was interesting. The other thing I wanted to kind of touch on is you and I kind of allude to and say things about theory. So I thought it might be helpful for those who are an undergraduate or are exploring this or don't parents. So a theory of counseling is a way in which a person or a therapist kind of understands a person and how their personality develops, the role of the therapist, and beliefs about change and what that looks like. And so there are multiple theories, and there's been a lot of research on them, and there's more theories coming out all the time. And our theory is grounded in something called humanism, where you're focusing on the whole of the person based on Rogers and person-centered theory, and really how an innate trust in the individual's capacity to move towards growth.
Yep.
Is that a succinct way to put
Yeah.
that?
Very interesting. Yeah. No, I think it was clear, but helpful. And I would also say about theories, not only do we look at them as if they see a person as a whole, or there's parts of a person that need to change to help fix the stress or kind of whatever that is. Some theories are more directive, meaning that the counselor is doing more guidance for the client and kind of helping them or directing them on how to make change, where a more humanistic or a less directive therapist is acting more as a mirror and highlighting the impact of the distress on the client and giving space for the client to problem solve through that without the therapist like directing them where to go. And so it depends. You'll hear it called like directive or non-directive, humanistic, cognitive based, right? There's lots of little terms that we use. If people are seeing a therapist, if it's a play therapist or an adult therapist or an experiential therapist, I hope they explain what they're doing and why they do it to you early on so that you have a better understanding of kind of their approach to working with clients, if that kids, adolescents, adults, couples, families, whatever it is, that they kind of help bring that to some transparency for you so you can have a better understanding. And if you're confused, you can always ask. So if you're a parent of a client, of a kid client, right, you can ask the therapist, tell me more about, right, how you're approaching working with my child. And so,
Yeah. And I think you and I are pretty grounded. We're very grounded in our theoretical perspective. And so this is from this podcast, I think, in our experience comes from a child-centered,
humanistic, right?
a humanistic. And I think that it doesn't mean that we're saying that other things don't work. It's saying for us, this is how we align, and this is where our passion lies. I encourage everyone to kind of start out with person-centered because I think it lays a really strong foundation as to why we do play therapy and the purpose of play therapy and how we engage with kids, and then start to explore. So if this doesn't quite fit right for you, what aspects of it don't fit, and how could you exploring what other theories might fit better.
Yeah. And I know with supervisees and the students that I work with, I always talk about theory as how do we align what matches close with our personal beliefs? Because I don't know if there's any theory that's 100% perfect for you, but what is closest to 100? And it's what we're focusing on when we kind of talk about theory is like what Maggie shared earlier. What do you believe about people? How do people come into this world, right? What causes them maybe to go off course or to experience a lot of distress? And what supports do they need to get back to their baseline functioning? There's also a big push in our field right now, in the mental health field in general, to almost be a shift changer, like that we're just going to automatically change the way we interact with different clients. It was taught to me different, and and now that I've been in the field for several years and have practiced, I think I have a better understanding of kind of what that means. But I always look at it as your theory guides you, but you may use different techniques to help support a client. And so as a play therapist, I'm still conceptualizing or understanding my clients' difficulties, anxiety, distress, whatever term you want to use, from a lens that is pretty consistent across all clients. That doesn't shift. So my thinking doesn't shift. What shifts is based on what I believe clients need, what my role is as a clinician. I may like handpick some different theory skills or techniques to bring into my session. And so the eclecticism that we're bringing is more of a technical eclecticism than a theoretical eclecticism.
Yeah. I
And
think
so,
that's important.
because I think people feel you have to be one or you have to be another or you have to constantly be shifting. But I don't know how we constantly shift our understanding clients from like a baseline. That really doesn't make a lot of sense to me. And I feel when I think students or supervisees doing that, they're trying for this client, I'm going to focus more from an Adlerian play therapy lens. And for this client, right, I'm going to be person centered or child centered. And for this client, I'm going to be cognitive behavioral. They tend to have a lot more confusion of understanding what's happening for their clients. And then they have difficulty explaining what's going on to parents, caregivers, to teachers, whoever it may be, right? Because I think that's becoming a different person. Like, do we really believe, based on who I'm interacting with, that I have to conceptualize them totally different? Do I have to understand them totally different? I don't think so.
No. And I think there's a big push. I mean, I think like there's both and. I think that you and I are in academia where we are trained extensively, felt exhausted when we were there, but I have so much more to learn still. And we've both worked out outside of academia as well. And I remember a lot of times working within different agencies, people saying, well, you can't be person centered and work in intensive outpatient. You can't be child centered when you're doing this. And I think that's a misconception as to, I think it's a focus that we have in the field and this movement towards 6 sessions, all better. And how can we move quickly? And that's hard to do, but it doesn't mean it's not effective.
Yeah. Well, it's interesting because I can't recall where I read this. This was a research article that I read that it actually, right, that belief that people can totally change in 6 sessions, right? They may be able to handle a specific scenario in 6 sessions or less, but they tend to become more reliant on seeking help when we hyper focus on short-term therapies.
Because we're telling them how to do it.
And I think the other belief is that children can't be successful in 6 sessions in child-centered play therapy. And I have seen kids quickly become successful in child-centered play therapy. It's not the norm. Sometimes it takes a little longer, but it doesn't mean they're going to be in therapy their whole life, right? That's not what we're saying. I just think it's a confusing message. I also I struggle when we so quickly judge what works and what doesn't work. I think it's a personal way of practicing. It's not like I don't think my theory is better than all the other theories out there. It's what fits best for me, and it has been helpful for the clients that I serve. And I want to respect the other approaches to play therapy or counseling to say, this works best for you. And I don't want to demean another, but I sometimes feel person-centered or child-centered gets written off really quickly by a lot of clinicians in the field. And as a person-centered and child-centered therapist, I'm always, help me better understand. And maybe that's just, we jokingly say in child-centered, it's a way of, well, we don't jokingly say, it actually is written by kind of the founders of our profession. It's a way of being, it's not a way of doing. And so I think that idea that, the unconditional positive regard, acceptance, empathy, maybe that's what you're hearing from me talking about other theories. I don't disregard other theories. I think they all are helpful in different ways. This is what works best for me.
Yeah.
And I'm sharing this because as, you're exploring what type of therapist you want to be, I hope you stay open-minded and know that others may feel differently about than how you feel, and that's okay because that may not be the right fit for them, but this may be the right fit for you. So I encourage you to follow your heart. I encourage you to try it on and see what it feels like. And if it doesn't feel enough, then yes, explore other theories. I know Maggie shared, like, start with child-centered. It is foundational, and it's so much more than just the foundation.
Yeah.
And so
When I think taking it back to where we kind of started is how is this therapeutic? And you're talking about as a core tenet, I think across most theories, but it's enough within person-centered and it's a part within all other theories for child-centered is unconditional positive regard, the authenticity, genuineness. And so what that means is that we are creating a relationship where we are presenting that there's really nothing in this room that you can do that is going to stop me from caring about you, that unconditional positive regard. And I'm going to be authentic and genuine so that you're not having to guess what's going on with me because you might guess that incorrectly or think that it's about you. And both of those things, if they feel judged or that I'm not being real, can impact how vulnerable a person's willing to be with you. And so in order to be vulnerable, we really have to present in these ways. And the other aspect I think that was helpful that you kind of touched on was my mind's blanking because I'm tired of what did we talk about? But about reliance on the therapist, right? So one of the big things that we're trying to do in the play space is helping also kids learn to trust themselves and
listen to themselves instead of being directed by people around them. I think that's how we create a lot of people-pleasing individuals in our society, or people with a lot of indecision because they've never had to try, right, to make a choice or a decision for themselves because people often do it for them.
and that they're capable of doing hard things. And that's also capable of experiencing hard feelings or ickiness and that I trust that they can handle that. And I am here as they struggle in that. The ultimate goal of therapy is to not need therapy. And so I want to create a situation where the child feels as if they are capable.
Yes.
And so that's part of the reason why I want to be a big part of what we're doing also is that helping them trust themselves and believe in their capacity.
I think the other component that we've kind of talked about but haven't really touched in is that idea of empathy, right? And conveying our understanding to the client in an accepting way. But also the skill that teaches is reflection, right? Self-understanding, self-awareness, and reflection. That I can know what's in my heart, know what my desires or my wants are, and be okay with that, that I don't have to switch. I've been talking with some of my students in Lifespan about adolescence and the topic that comes up frequently in adolescence with peer pressure, or how do they risk-taking behavior. So that idea that they have a strong want or a desire and they enact on it without thinking or reflecting, is this safe? Is this not safe? Those types of things. And I feel in the playroom, by using our empathy and reflection skills, we're kind of helping kids gain the skill of knowing how to reflect and have self-awareness. I may really want to drive fast and get home lickety-split super quick, but I also can't break all the rules, or I live in a congested area of Charlotte, and I could also cause harm or danger to someone else. And so that ideal that, yes, I have to get home super fast. And I'm frustrated people are driving slower than I would them too. And they may be obeying the law and driving the speed limit. But that's on me. I can know where that's coming for inside myself, and then I don't have to enact on those desires or those wants. And I feel like that's something that play therapy helps children develop inside themselves. We might call it regulation. We call it all different things in society, but it really kind of helps them to self-police themselves in a way that also allows them to be real and true to themselves.
And express what's going on for them in that moment or know what's going on for them in that moment. So I think this is by no means exhaustive as to what we do in the playroom. And hopefully this is going to be a podcast with multiple episodes and we can continue to delve in. And for those that are listening, if there are topics that you want more of, let us know and we will explore them because I think it's fun having these combos.
I don't think we get to talk about this stuff enough. I hope as you explore being a play therapist or you are a play therapist, you find people that you can have these conversations with openness behind a process and really some self-reflection and some ability to share thoughts, ideas about yourself.
Absolutely. Well, thanks, Kristie. This was fun.